On Tomorrow's World Today, we explore the cutting-edge advances that are shaping 4 different worlds. The world of inspiration, where the wonders of the natural world amaze and inspire us. The world of creation, where ideas come to life from traditional arts. The world of innovation, where ideas and inventions move us all forward. The world of production, where innovations are mass-produced to improve our lives. From Invention Land World Headquarters, here's your host, George Davison.
Dentistry sure has come a long way from its humble beginnings. In the early days, these rudimentary tools and techniques defined dental care, and it offered limited solutions to common oral health issues. Today, the landscape for dentistry is dramatically different, and it's marked with these remarkable advancements and innovative practices that enhance patient care and outcomes. One of the most significant drivers of innovation is something called a DSO, which stands for a Dental Support Organization. These organizations are revolutionizing how dental practices operate more innovatively by providing essential non-clinical support. Now, what that does is it allows the dentists to focus on what they do best, provide patient care, not running the office. These DSOs are integrating cutting-edge technologies like digitally scanning the inside of a mouth and converting the data into math that will be necessary to run a 3D printer that will print the teeth that are needed for the patient. DSOs are figuring out how to make our dentists better. So I'm going to send Greg to the world of innovation to explore how these innovations enhance patient experiences and make dental care more accessible and efficient than ever before.
In today's rapidly evolving dental industry, there's a new trend that's transforming the way patients receive care and the way dental practices are supported. Dental support organizations, or DSOs, are revolutionizing dentistry all across the country. I'm in Orlando, Florida, to meet with Dr. Rick Workman, the founder of Heartland Dental, and we're going to discuss the benefits of DSOs and how they are shaping the future of dentistry in tomorrow's world. Hey, Dr. Workman.
Hey, good seeing you. How are you?
Good to see you. I'm great. So, Doctor, tell me a little bit about the evolution of dentistry in the United States. It wasn't always even a recognized profession.
It's so true. Been a lot of advances over the years. Dentistry got its first dental school in Baltimore in the early 1800s. Since then, dentists have worked hard on studying the science, understanding the science, and how to apply that to oral health. We now know today a lot of connections between oral health and systemic health, so a lot of changes over time.
Well, how about the changes since you got out of dental school?
Well, believe it or not, when I graduated from dental school in 1980, out of all the dentists in America, 98% were male and 98% were white. Today, there's massive diversity in dentistry. 57% of all people going to dental school today are women. And so, as we've had a lot of technology changes, there's been a lot of social changes. It's very interesting and exciting times in dentistry.
Excellent. Well, I'd love to learn more.
Well, come on in and we'll talk about it. Look forward to it. Welcome to my office.
Well, thank you very much. So, Doctor, let's talk a little bit about what was going on in the dental industry that inspired you to start Heartland.
First of all, I didn't set out to start Heartland Dental. When I set up my first practice in Effingham, Illinois, I quickly began to figure out how much I needed to learn as a dentist and all other aspects of running a dental practice, including figuring out how to withhold taxes, et cetera, and stay solvent. Through a lot of hard work and many hours over the course of the next decade, by the end of the 80s, I could see that there were changes coming to dentistry. The cost of education had increased a lot. We had maybe a dozen dentists working together, and we were building a community, and we were learning together. And some of the newer dentists could begin to figure out that they were learning faster, advancing in their career faster because of all of our interactions than some of their peers. And they began to see the value of that, and I began to see the value of that. And through that, eventually, what's now known as Heartland Dental supports 3,000 dentists nationwide. And that same community, learning together, has created a tremendous advantage for all of us.
You mentioned the cost of a dental education, and that's changed a lot. How has a dental support organization been able to make that a little less of a strain on a new dentist?
So my total tuition for dental school was $5,000, $32,500 to set up my first practice. Today, 20% of all new graduates have over $500,000 of student debt. Another 20% have over $400,000 of student debt. This year, Heartland Dental will open over 100 new practices at a cost of over $1 million per practice. It's almost impossible for new graduates to do that or replicate that. They do get the opportunity, though, to walk into a practice like that who has the latest in technologies, systems are in place, there's a mentor doctor they can work directly with. As a community working together with our 3,000 supported doctors, some of which may be their classmates working in another town, they can learn together and greatly accelerate their uptake of the technologies and all the new protocols that modern dentistry has.
Being able to keep up with that, like you mentioned, the technologies and the learning curve that somebody's up against now, to do that in isolation would be extraordinarily difficult. So what you're really talking about is dentists helping dentists and really hoping that the through line is that it gets to the patient.
Absolutely. Okay. When there was a time where things were slowly changing, you wouldn't have to do much different for 5 years. Today, technology changes every 6 months, and you've got to have somebody be an expert, or you're going to be left behind.
Right. Well, I can't wait to see this all in action, so I'm going to head down to one of the offices.
I can't wait for you to meet our team.
Dental Support Organizations, or DSOs, are revolutionizing the dental industry by providing essential administrative and operational support, allowing dentists to focus on patient care. I'm in Orlando, Florida, where I'm going to talk to Dr. Michael Badger, a Heartland Dental supported doctor, about how DSOs are continuing to shape the dental industry. Hey, Dr. Badger.
Hey, Greg, how you doing?
I'm great. Nice to meet you.
Nice to meet you.
Well, I was talking with Dr. Workman. He was really excited for me to get down here to O-Town West and see what your team does. I'm excited too, but we were talking about new technologies in modern dentistry. What's the most exciting thing to you right now?
Without question, it's AI diagnostics and 3D printing. AI diagnostics supports my diagnosis. It allows for early detection and allows for my patients to see what I see.
Excellent. Well, I'd love to get a tour of the facility.
Love to show it to you. Come on.
Okay, so this, what you can see here, is an early decay. The good thing is that we were able
This is
to
an example of AI being utilized in our practice right now. So yeah, what we're talking about. Hey!
Hi, doctor.
Hi,
How are
Angeline.
you?
Hi. Hey, Danielle, how you doing today?
Doing good.
It's so good to see you again. I have a dear friend, Greg, here, and I know you all are talking about what's going on in your mouth. Do you mind if I share a little bit about what's going on as far as your AI platform here? Just a little bit. Okay, great. You and I were talking earlier about how AI has enhanced the patient experience so that they can see what we see, and we're able to share that message and gain patients' acceptance and the understanding. We're able to treat those things early on, and catching them at an early rate will allow us to be able to make the patient's experience that much better. Would you mind flipping that over to the way we look at these x-rays ordinarily? And we're sitting up trying to explain these things to patients on day in and day out, and you see the difference.
So as I'm looking at these AI X-ray images, the pinkish red areas indicate tooth decay, and the yellowish translucent areas indicate what's actually starting to decay. Now, the yellow areas aren't visible with the naked eye, and these are the trouble spots that will need to be watched closely.
Absolutely. And the patient sees and they get it and they understand the urgency and importance of treating this while it's early on. Because we believe that the best dentistry is the least amount of dentistry.
Right, right. Now, you'd also mentioned how important 3D printing is going to be in the future. Can we take a look at that?
Absolutely. Let's
All
go
right.
do it. Thank you both.
Thank you, doctor.
Good to see you.
Thank you.
Okay, do you have any question about
So Greg, this is one of our 3D printing platforms that's actually making a prosthesis for a patient right now.
So this is creating new teeth for a dental patient?
Absolutely.
What's it going to look like when it's done?
Well, this is a provisional that we made for a patient. So imagine someone coming in with no teeth or badly damaged teeth, and they walk out with a brand new smile.
This is so realistic looking.
Yes.
How does this whole process start?
It starts with digital scanning, and I know Dr. Power is going to go over that with you right now.
Excellent. Well, we'll catch up in a bit. Thank you.
Thank you.
So in talking to Dr. Badger, he talked a lot about AI, 3D printing, a lot of the new technologies that are being incorporated into modern dentistry. I know you're really excited about digital scanning.
Oh, absolutely. But before I show you digital scanning, I think it's really important to talk about traditional dental impressions. You know, traditional dental impressions were so delicate, and the fact that dentists ever got it right is actually shocking. So this new technology has eliminated a lot of human error. Let me show you a little bit about digital scanning in here. So if you take a look, our hygienist is scanning a patient, and right here in real time, we see her teeth coming up on the screen. Isn't that cool?
That's very, very cool. So this is actually what's happening inside her mouth as we speak.
That's right. And she's able to see it in 3 dimension, and so am I. So we're using these for accurate fitting restorations, everything from dentures, partials, and crowns. But I think what's more important is we're using this as a patient education tool.
Well, how does that work?
So you've probably never seen your mouth outside of your head in 3 dimension.
No, I don't believe I have.
Right, and so there's a lot of trust between a doctor and a patient, meaning I usually look in their mouth and I tell them what's going on. But now instead of just telling them, I can show them.
So educating the patient is clearly very important, but education seems to be a really integral part of the whole organization, dentist to dentist as well. So let's go talk to Dr. Badger about that.
That sounds good, let's do that.
Ordinarily, and we're sitting up trying to explain these.
Technological advancements like artificial intelligence and 3D printing are transforming the dental industry. These innovations are revolutionizing dental practices, enhancing patient care, and streamlining operations. I had a chance to sit down with both Dr. Badger and Dr. Plower of Heartland Dental to further explore the peer-to-peer network that is setting new standards in dentistry. Hey, Dr. Badger.
Hey.
Good to see you again.
Good to see you as well. Hey, Doc.
Hey, how are you?
I'm good.
Well, Dr. Plower and I were talking about digital scanning. You and I talked about AI, 3D printing,
Right.
all of the new technologies that are being involved in
Yes.
modern dentistry. But one of the things that's really intriguing me is the peer-to-peer network that you all work in. Tell me more about that.
Honestly, it's a doctor to doctors. Doctors helping doctors to become the best that they can so they can serve their patients the best way that they can. You know, I practiced for 15 years on my own. And honestly, when you're working in that type of environment, as pretty much every doctor does in the country, you're working on an island by yourself. And there are things you got to deal with on a day-to-day basis that you may not be accustomed to dealing with as a young doctor fresh out of school. So having someone that you can lean on in a non-threatening environment, someone who's willing to share and give you positive exchange and give you positive feedback is one of the blessings of what Heartland Dental does and how we do it.
Right, and I guess you came into this network as a new dentist. How was that for you?
Yeah, so my experience was a little different than Dr. Badger's. So I joined as a Heartland-supported dentist right out of dental school. And I did that because dental school really taught me the fundamentals of how to treat patients. But what I was really lacking was communication skills and leadership skills, and that's what Heartland offers. Education is such a key part of our culture. Heartland Dental University offered me Bell leadership classes, offered me communication courses, and then outside of the classroom, they offered me mentorship. So I spent some time in Dr. Badger's office, and I watched him lead a team, I watched him communicate with patients, and that's been a key part of my growth.
Excellent. Well, I guess we're all about to learn a little bit more about that when Pat Bauer meets up with George back at Invention Land, so thank you very much.
Thank you.
Thank you.
Thank you very much.
Hey, Pat, welcome to Invention Land.
Hey, George. Super nice to meet you.
Well, it's great that you're here. I've been looking forward to you coming in and talking a little more about the dental industry and some of the technology and innovation going on.
Well, the lifetime care for our dentists has not fundamentally changed because it's still about lifetime care, the dentistry lasting for a lifetime. But what's changed is all the different products in innovation, like digital x-rays 20 plus years ago. Now we put AI in that digital x-ray. We also have Curidon and Align and Invisalign to make sure that the function is there. And our supported doctors are constantly looking for the best products to deliver that kind of care to their patients in the communities they serve.
Isn't that fabulous?
It is, it's amazing.
Amy, you're integrating AI into it now and just more and more progress. That kind of leads me into some of the pictures that your team sent in, and I was hoping you could go over some of that with me. I really couldn't figure out what was going on.
Well, this is Dr. Plower. She's one of my favorite doctors. She is using an iTero scanner. So that's an iTero scanner, and back in the day, they would use goop. So when they were doing a crown or Invisalign, an orthodontic procedure, we would then put goop in the patient's mouth, which would then make an impression of that tooth. And nobody likes goop.
No.
And it's really awful. Well, now this is a digital impression that is much more accurate. The digital impression then gets sent digitally to the lab, so there's no mail going back and forth. And then the final product is sent so that they can seed it with the patient, both Invisalign and the crown. And that's a massive innovation. I mean, now the patient can actually see on a screen what their mouth actually looks like. And they can see it blown up on a big screen and say, oh, why does it look like that? And now they can, so it helps the patient understand what they're doing and why the doctor is doing what they're doing.
I've been in that position just like that girl, and that goop was down in there. It did not feel good.
Nobody wants goop in their mouth.
That's a great advancement.
It is. It's a massive innovation, and it keeps on getting better. They're making the wands smaller. They're doing it. They keep on making them better and better so that the experience, not only for the patient, but for the doctor, is that much better.
That's a
and
big
that
advance.
creates everything.
That's, yeah, I really like that one.
Smart technology in the dental industry saves time and money and provides more options for preventative care for patients. We're continuing our conversation with Pat Bauer, Heartland Dental's President and Chief Executive Officer, about what the future holds for the intersection of technology and dental care and how dental support organizations, or DSOs, will continue to lead the way in innovation.
You know, they sent me these other pictures too. Could you explain this one, Pat?
Yeah, this is a hygienist that looks like she's cleaning a patient's teeth. And what she also has the ability to do there is use Curidon. Curidon is a product. Do you remember back in the day when you went to the dentist and they'd say, well, if you have, I see this small cavity and it's just too small, so I'm going to watch it?
Yeah, I remember
So that watching now no longer has to happen. As soon as they say watching it, they can use Curidon, which is a peptide type of liquid that goes on the tooth. The hygienist puts it in, and it remineralizes the enamel. So now you don't have to have a drill that is now very painful to go in there and take it out. It goes away. So it actually grows the enamel. It's almost as innovative, honestly. It'll change the decay model from when fluoride did it back in the day. When they first started putting fluoride in the water, it was to make the teeth stronger, so that the decay would be less. Well, this is also going to change the model, because now if you don't have to, if you can put this on it and you're a child or an adult and you don't have to have a filling, it's the best lifetime care we can deliver to a patient. Because now I don't have to have a filling, and you don't have to have that, that grinding of the drill that you can hear.
Right, or the pinch of the cheek, and they stick you with the syringe,
Needle.
and then the smell of the, what is that smell?
Hair,
It's
the
like
hair burning smell.
Right,
it's
right.
just terrible.
Yeah,
It's
the
awful.
burning teeth is
yeah,
not a
it's
good
just
smell.
it's not a good smell. And that's why it's so innovative for them to be able to do this. And the hygienist can place it, and it's just the best care that we can deliver to our patients.
That's wonderful. What a great advance.
It's amazing.
All right, well, talking about advances, I was hoping while I have you here, you could tell me a little more about the future of dentistry in tomorrow's world?
Well, if you think about it, most dentists graduating today won't own their own practice. The amount of debt that they have, how much it costs to start a practice is very prohibitive. Plus, they have all that back office stuff that they have to worry about: insurance, HR, technology, regulatory issues that come about. They don't have time for that, plus being the best dentist that they can be. And so the future is more people like us supporting doctors so that they can really lead their practices and really do better patient care, which is really lifetime care for the communities they serve.
And me as a patient, I'm liking what I'm hearing, because the dentist is going to be a much happier person while they're working on me, right?
Yes, exactly.
That's a good innovation. Thank you for that.
You're welcome.
So how about a tour of Invention Land?
I'd love to see it.
All right, come on, let's do it. And remember, tomorrow's world is where inspiration and creation drive innovation in production. See you next time.